8 medications that damage memory and the brain. Did you know that some common medications can harm your memory and brain health? Have you ever wondered if the medication you're taking might be contributing to cognitive decline? What if you could identify and avoid these medications to improve your quality of life? Recent research indicates that memory loss is not an inevitable part of aging. Certain medications used without proper oversight can have significant adverse effects on the brain. Why do seemingly harmless drugs cause such severe damage? And how can we protect our brains while treating other health conditions? Studies show that proton pump inhibitors, such as omeprazole and anticholinergics used to treat conditions like Parkinson's disease, increase the risk of dementia. Are we truly aware of these risks? Self-medication can exacerbate these effects. Stick with us until the end, because medication number 7 is the most dangerous, and almost no one knows about it. It's important to mention that all references used to create this video are listed in the description for you to access anytime. Let's get started. Aging and dementia. What do we really know? For a long time, it was believed that dementia and cognitive decline were inevitable consequences of aging. However, recent research has challenged this perspective, suggesting that memory loss is not a normal and unavoidable part of growing older. Dementia, including Alzheimer's disease, results from specific pathological processes that affect the brain, not simply advanced age. Studies indicate that it is possible to keep cognition sharp and even improve certain skills as we age, provided that risk factors are managed effectively. Various factors contribute to brain health in old age, including a balanced diet, regular exercise, mental and social stimulation, and management of chronic conditions like hypertension and diabetes. However, there are lesser-known elements that can trigger or worsen cognitive decline. Alcohol abuse, smoking, brain injuries, strokes, chronic insomnia, and persistent stress are widely recognized as detrimental influences on brain health. Additionally, nutritional deficiencies, especially vitamin B12, and psychiatric disorders play critical roles. Understanding the processes underlying dementia has significantly advanced, emphasizing the importance of tau and beta-amyloid proteins in forming tangles and plaques that damage brain cells. Moreover, genetic factors can predispose certain individuals to develop dementia, although environment and lifestyle can significantly modify these risks. Preventing dementia requires a multifaceted approach that includes promoting a healthy lifestyle, controlling chronic diseases, and utilizing medical interventions when necessary. Ongoing research continues to explore new therapies and interventions that may slow or prevent dementia's progression. Recognizing that cognitive decline is not an inevitable part of aging can inspire changes that promote brain health throughout life. Surprising factors that contribute to memory loss. Memory loss is a complex phenomenon resulting from various factors. In addition to well-known causes like aging and neurodegenerative diseases, there are other less obvious but equally impactful ones. Substance abuse, such as alcohol and tobacco, is a significant factor. Alcohol can directly damage the brain, while tobacco contributes to vascular issues affecting brain health. Traumatic brain injuries from accidents or contact sports are common causes of memory loss. These injuries can cause immediate damage or lead to long-term cognitive problems, such as chronic traumatic encephalopathy. Strokes are another significant factor, interrupting blood flow to the brain and causing damage that affects memory and other cognitive functions. Insomnia and sleep disorders have a direct relationship with mental and cognitive health. Chronic sleep deprivation interferes with memory consolidation processes, making it harder to retain new information and retrieve existing memories. Chronic stress is also harmful. Cortisol, the stress hormone, can damage brain structures involved in memory, such as the hippocampus. Nutritional deficiencies, particularly vitamin B12, are another less recognized cause of memory loss. Vitamin B12 is essential for neuronal health, and its deficiency can lead to significant neurological symptoms, including memory loss and mental confusion. Psychiatric disorders, such as depression and anxiety, also impact memory. For example, depression can lead to decreased concentration and recall, while chronic anxiety can hinder the brain's ability to process and store information. In summary, memory loss can be influenced by a combination of factors, any of which can be prevented or managed. Awareness and proper management of these factors can help preserve cognitive function throughout life. Common medications that can damage your memory. Many commonly used medications can adversely affect memory and cognitive function, often unbeknownst to patients. While these medications effectively treat various health conditions, they can also have significant side effects, including memory deterioration and other cognitive issues. Below, we explore how some common medications can negatively impact the brain. 8 medications that damage memory and the brain. Omeprazole and its hidden dangers to the brain. Widely prescribed for conditions like heartburn, omeprazole belongs to a class of medications known as proton pump inhibitors, PPIs, which also includes lansoprazole, pantoprazole, and esomeprazole. These medications effectively reduce gastric acid secretion, providing relief from symptoms of reflux and gastritis. However, prolonged use has been linked to serious risks to brain health. Epidemiological studies indicate that continuous PPI use correlates with an increased risk of dementia and memory loss. One study, involving around 6,000 participants, revealed that 10% of those taking omeprazole for over 3 years experienced memory loss. Another study found that 33% of patients using the drug for more than 4.5 years reported cognitive disorders. The connection between PPIs and cognitive issues may relate to decreased absorption of vitamin B12, a vital nutrient for neurological health. A deficiency in B12 can lead to neurological and cognitive disorders. Furthermore, PPIs can alter gut microbiota, negatively impacting brain function. The indiscriminate use of omeprazole is common due to its availability without a prescription. However, it's essential for patients to consult their doctors before starting long-term PPI treatment. An accurate diagnosis of conditions like gastritis or ulcers should precede the prescription of these medications. Generally, PPI treatment should be limited to periods of 2 weeks to 3 months, depending on the medical condition and necessary dietary adjustments. In addition to cognitive risks, prolonged use of omeprazole is also associated with other health issues, including vitamin deficiencies, kidney diseases, bone fractures, and an increased risk of respiratory and intestinal infections. Therefore, it's crucial to use these medications cautiously and under strict medical supervision to avoid long-term complications. Anticholinergics. The dark side of popular medications. Anticholinergics are commonly used to treat various conditions, including Parkinson's disease, overactive bladder, and certain respiratory disorders. They work by blocking the action of acetylcholine, a neurotransmitter essential for many bodily functions, including memory and learning. While effective, these medications can have significant adverse effects on the brain, especially with prolonged use. Studies show that anticholinergics are associated with a substantial increase in the risk of dementia and other cognitive disorders. Research conducted by the University of Washington, which followed over 3,500 elderly individuals for 10 years, found that those who regularly used anticholinergics had a 54% higher risk of developing dementia. This risk increased with the dose and duration of use. The most common anticholinergics associated with cognitive decline include scopolamine, mecamylamine, atropine, benztropine, oxybutynin, trihexyphenidyl, and dimenhydrinate. These medications interfere with neuron communication by blocking acetylcholine, impairing memory and learning processes. On the other hand, some anticholinergic medications, such as glycopyrrolate, trospium, tolterodine, daraphenecin, fesodorodine, tiotropium, and umeclidinium, especially when administered by inhalation, have not been linked to these adverse cognitive effects. The indiscriminate use of these medications, particularly among the elderly, is concerning due to their potential contribution to cognitive decline. Patients and healthcare providers must carefully weigh the risks and benefits of anticholinergics, seeking alternatives when possible and limiting use to the minimum necessary doses and durations. Besides cognitive risks, anticholinergics can cause other side effects, such as dry mouth, constipation, urinary retention, and blurred vision. Therefore, awareness of the risks associated with these medications is vital for preserving cognitive health and quality of life, especially in vulnerable populations like the elderly. Corticosteroids, when treatment affects your brain. Corticosteroids are powerful medications used to treat a wide range of conditions, from asthma and allergies to autoimmune and inflammatory diseases. However, prolonged use of corticosteroids, particularly when taken orally, is associated with several serious adverse effects, including deterioration of mental and cognitive health. Studies have shown that corticosteroids can cause structural changes in the brain, leading to problems like disorientation, confusion, depression, and anxiety. An epidemiological study in the UK, analyzing data from over 500,000 individuals, revealed that those using corticosteroids for asthma over extended periods faced a significantly higher risk of developing dementia and other mental health disorders. Glucocorticoids like prednisone and dexamethasone are particularly concerning when used long-term. They can interfere with brain function, possibly due to alterations in cortisol levels. Elevated cortisol levels can damage neurons in the hippocampus, the region responsible for memory. Even inhaled corticosteroids, such as fluticasone, budesonide, and mometasone, while considered safer, can have negative impacts when used in high doses or over extended periods. Besides cognitive risks, prolonged corticosteroid use is associated with other adverse effects, including osteoporosis, diabetes, hypertension, and increased susceptibility to infections. To minimize these risks, it is crucial that corticosteroid use is closely monitored by healthcare professionals. Patients should be encouraged to discuss any concerns regarding their medication regimen with their healthcare provider, especially if they notice changes in mood, memory, or cognitive function. Exploring alternative treatments or adjusting dosages may help mitigate these risks while still effectively managing their underlying conditions. Benzodiazepines, the double-edged sword of anxiety relief. Benzodiazepines are commonly prescribed for anxiety, insomnia, and seizures. While they can provide significant short-term relief, these medications come with a risk of cognitive impairment, particularly with long-term use. Studies have shown that benzodiazepines can interfere with cognitive function, affecting memory, attention, and decision-making abilities. Research from the University of Michigan found that individuals using benzodiazepines regularly had a higher risk of developing dementia. One particular study indicated that older adults taking benzodiazepines were 51% more likely to be diagnosed with Alzheimer's disease than those who did not use these medications. The cognitive effects are especially concerning for the elderly, who may already be at risk for cognitive decline. The mechanism behind this cognitive impairment may involve benzodiazepine's sedative properties, which can impair the brain's ability to form new memories. Additionally, prolonged use can lead to tolerance and dependence, making it challenging for patients to discontinue use without experiencing withdrawal symptoms. To reduce the risk of cognitive impairment, healthcare providers often recommend limiting the duration of benzodiazepine treatment, especially in older adults. Cognitive behavioral therapy, CBT, and other non-pharmacological interventions can be effective alternatives for managing anxiety and insomnia without the associated cognitive risks. Patients should work closely with their healthcare providers to develop a treatment plan that addresses their needs while minimizing the potential for cognitive decline. Antidepressants. Are they worth the risk? Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, are among the most commonly prescribed medications for depression and anxiety. While they can be effective in treating these conditions, some studies suggest that long-term use of certain antidepressants may be linked to cognitive impairment and memory problems. Research has indicated that older adults taking SSRIs may experience an increased risk of developing dementia. One study showed that patients aged 65 and older taking SSRIs had a 25% higher risk of cognitive decline compared to those not on these medications. The exact mechanism behind this association remains unclear, but it may involve serotonin's role in brain function and neuroplasticity. Other classes of antidepressants, such as tricyclic antidepressants, TCAs, have been associated with a higher risk of cognitive decline due to their anticholinergic properties. These medications can impair memory and cognitive function, particularly in older adults. To address these concerns, healthcare providers should carefully consider the risks and benefits of antidepressants, especially in older patients. Non-pharmacological interventions, such as therapy and lifestyle modifications, can be valuable components of a comprehensive treatment plan for depression and anxiety without the risk of cognitive impairment. Sleep medications, when rest comes at a cost, Sleep medications, including benzodiazepines and non-benzodiazepine sleep aids like zolpidem, Ambien, and isoprolol Lunesta, are commonly prescribed for insomnia. While these medications can provide temporary relief, they may also contribute to memory impairment and cognitive decline. Research indicates that sleep medications can interfere with normal sleep architecture, leading to fragmented sleep and reduced deep sleep. This disruption can hinder memory consolidation, making it more challenging to retain and recall information. A study conducted by the American Academy of Sleep Medicine found that long-term use of sleep medications was associated with an increased risk of cognitive decline and dementia in older adults. Moreover, sleep medications can cause sedation and impair motor skills, leading to an increased risk of falls and accidents, especially in the elderly. To minimize these risks, healthcare providers should prescribe sleep medications cautiously and consider non-pharmacological alternatives, such as cognitive behavioral therapy for insomnia, CBTI, and lifestyle modifications to improve sleep quality. Patients struggling with sleep issues should discuss their concerns with their healthcare provider and explore potential alternatives that promote better sleep without compromising cognitive health. Statins. Do they really protect your brain? Statins are widely prescribed to lower cholesterol levels and reduce the risk of cardiovascular diseases. While they are effective in preventing heart-related issues, recent research has raised concerns about the potential effects on memory and cognitive function. Some studies have suggested that statin use may be linked to cognitive impairment, particularly in older adults. One study published in the Journal of the American College of Cardiology found that patients taking statins reported more memory problems than those not on these medications. The mechanism behind this association may involve statins' impact on brain cholesterol levels, which are crucial for neuronal function. However, the overall evidence on statins and cognitive function is mixed, with some studies indicating no significant association between statin use and cognitive decline. The FDA has issued warnings about potential memory issues associated with statins, but the agency also emphasizes that the benefits of statin therapy in reducing cardiovascular risk typically outweigh these potential risks. Patients should discuss any concerns about statins and memory with their healthcare provider. It's essential to weigh the risks and benefits of statin therapy based on individual health needs and to consider regular monitoring for cognitive changes during treatment. Opioids, the silent cognitive threat. Opioids are powerful pain-relieving medications often prescribed for acute and chronic pain. While they can provide significant relief, opioids are associated with various cognitive side effects, particularly with long-term use. Research indicates that opioid use can impair cognitive function, affecting attention, memory, and decision-making abilities. A study conducted by the University of Michigan found that older adults using opioids had a higher risk of cognitive impairment compared to those who did not use these medications. Opioids can affect brain function by altering neurotransmitter activity, leading to cognitive issues. Additionally, the sedative effects of opioids can exacerbate memory problems, especially in older adults. The risk of falls and accidents also increases, further compounding the cognitive challenges associated with opioid use. To mitigate these risks, healthcare providers should carefully monitor patients on opioid therapy, especially older adults. Whenever possible, non-opioid pain management strategies should be explored to minimize the potential for cognitive decline and other adverse effects. Thank you very much for watching our video. Like and subscribe to our channel. We will be glad to receive your comments. Write what topics you are interested in. We will shoot a video for you. Good health to you.